This video explains how to take your blood sample for HIV and syphilis testing. In your test kit, you should have a name label, 2 moist wipes, 2 alcohol swabs, 3 lancets, a blood collection tube, a protective packing wallet, 2 plasters, a security seal, a test request form, and a prepaid mailer. We've given you 2 alcohol swabs, but you'll only need 1. You have a spare just in case you need it. We've given you 3 lancets, but again, you'll only need 1, but we've given you 2 spares just in case. The protective packing wallet also doubles up as a blood collection tube holder so that you can hold your blood collection tube still and stable while you take your blood sample. A few things to note before you begin are, firstly, you need to fill in the test request form and write on the name label, but please wait until you've collected your blood sample before putting the label onto the blood collection tube. This is important so that you can see how much blood you've collected. If you put the label onto the tube before collecting your blood, you will not be able to see how much blood you're collecting. Secondly, it's much easier to collect your blood sample if your hands are warm. Thirdly, the best location for collecting your sample is from the side of your little finger. Fourthly, please note that lancets are for single use only. And lastly, when collecting blood drops for your sample, blood will flow more easily if you're standing up rather than sitting down. So when you're ready to begin, wash your hands with warm soapy water and then dry them. Use an alcohol swab to clean your little finger and then dry it with a clean tissue. Do make sure that your finger is completely dry, as blood won't form a drop at the puncture site if your finger is moist. Take the cap off the blood collection tube and place the blood collection tube in the protective packing wallet provided. Take 1 blue lancet and twist and remove the blue stick. The lancet will be ready to use. Now place the lancet on the end of your finger and press it firmly against your skin. The lancet will activate straight away, making a small puncture in your finger. You'll see a small drop of blood form. You should wipe the first drop of blood away with a clean tissue. Holding your hand facing downwards, firmly massage the side of your hand to encourage the blood to flow and let the drops of blood flow into the blood collection tube. Fill the blood collection tube so the blood reaches the upper line on the side of the tube. If you find you can't collect enough blood from your finger, use another lancet to prick a different finger and follow the same steps. Or you could try wiping your finger with a dry tissue, and after 10 to 15 seconds, blood drops will reform and you can start collecting them again. Once you've collected enough blood to reach the upper line, put the plaster on your finger to stop the bleeding. Now, push the cap onto the tube until you hear a click. Once the cap is on securely, turn the tube upside down and turn it back again 5 to 10 times. Once you've done that, stick the label onto the blood collection tube by wrapping it around the tube. Place the tube into the protective packing wallet provided and then put it into the white box with the used lancets and your completed test request form. Please remember to add your urine or vulvovaginal swab to the box before sealing it. Once you've checked that you've labelled all your samples and test request form clearly and correctly, you can seal the white box with the security sticker and place this into the prepaid mailer envelope. That's it done! You've taken your blood sample for HIV and syphilis testing, all without going to a clinic.